everybody? Awesome. Cool. My name is Jue Chu. I'm the Associate Director of Academic Programs here at SCET. We are so excited to be back in this building. We moved in here last fall, and we've had so much energy and excitement of having our classes in the same space and seeing everything that students have been working hard to build, and really excited for this year's Collider Cup. And so for the opening remarks, I will pass it over to Interim Dean Mark Asta.
Thank you. Good afternoon. Welcome to the Sutarja Center for Entrepreneurship and Technology Collider Cup. All right. Thank you for joining us here today as we celebrate the incredible work of our students. This is all about the hard work that all of you have put in. This year, SCET, I've heard it is now called, is celebrating the 20th anniversary, and today marks the 17th Collider Cup. Okay, so we're especially excited to have teams participating from 3 new courses: Applied Resilience, all right, RegenVen, Regenerative Ventures, all right, I like it, and Advanced Product Management and AI-powered startups, all right. So this semester, the effort, creativity, and energy displayed by our students and instructors has been phenomenal. They've truly embraced the full SCET ecosystem, and many classes enjoyed having access to our brand new space up on the 3rd floor. So this is the first year that SCET has moved back into the building and now it has the penthouse suite. We believe innovation skills are valuable for all work, which you're going to be doing in your careers, and we're going to see all of you do amazing things. And what's amazing to me about SCET as an interim dean of engineering is how the programs here that we offer through the college really draw from all across campus to the benefit of our engineering students, but all of you as well. So with that, I'd like to hand it off to our MCs for the afternoon, Annika and Daniela.
Good afternoon, everyone, and welcome to the 17th biannual Collider Cup, UC Berkeley's showcase and pitch competition for the Sutarja Center of Entrepreneurship and Technology Fall 2025 Venture Courses. My name is Daniela Sparrow, and I'm a senior at Cal studying political science and public policy, and I'm absolutely thrilled to be one of your MCs for this exciting event.
My name is Anika Casefalou. I'm a senior at Cal studying business and data science, and I'll be your second MC today. Today's event celebrates innovation and entrepreneurship. Over the past semester, the students presenting today have been ideating, testing, and refining solutions to some of society's most pressing challenges. We're proud to showcase the outstanding work of UC Berkeley's next generation of leaders and changemakers.
Anika and I stand before you as a testament to the transformative power of the entrepreneurial journey at UC Berkeley. Having attended the Global Entrepreneurship and Innovation Summer Abroad program in the summer of 2024, I experienced a profound transformation while developing an edtech startup. As a co-founder, my team and I aimed to remedy educational inequality in the United States by using a personalized AI model to maximize the learning capacities of all students alike. I think we can all agree that developing a startup is not the easiest task, but with the guidance and support of the SCET staff and mentors, I was able to develop a truly impactful product. My SCET experience has opened my mind in ways I could never have predicted, and it has taught me how I can use my creativity and my intellectual assets to make positive changes in the world through entrepreneurship. I'm absolutely thrilled to be here with such an incredible community of creative and dynamic thinkers, and I cannot wait for this event to begin.
I joined the SCET community when I participated in the Berkeley Method of Entrepreneurship Bootcamp in fall of 2024 and competed in the Collider Cup that same semester. As a part of the bootcamp, I co-founded a startup that aimed to centralize the hiring of trades workers, like plumbers, electricians, and construction workers, for trades businesses. Our ultimate goal was to show people that anything is possible, starting with the trades. Being a part of SCET has truly been such a transformative experience. It challenged me in ways I never expected, but also encouraged me to learn faster than I ever had before. It showed me how to channel my creativity and problem-solving skills into meaningful, real-world impact through entrepreneurship. I'm so grateful to have found and been surrounded by such a great community of passionate individuals through SCET, and I'm beyond excited to kick off today's event.
This legacy of innovation and entrepreneurship is alive and well at UC Berkeley, and events like the Collider Cup showcase the incredible potential of young founders. This is possible thanks to the dynamic, hands-on courses organized by the Sutarja Center for Entrepreneurship and Technology, which I will further expand upon throughout today's event. SCET started in 2005 teaching a single course and now teaches 15 to 20 courses per year, educating 2,000 plus students per year that collide with over 80 majors represented amongst these courses. As you probably expect, more than one major expertise is necessary when trying to solve the world's most challenging problems, like educational inequality. These students are pushing the boundaries of what is possible and constantly challenging the status quo.
Let's take a moment to recognize and thank our esteemed judges. Their expertise will be invaluable in evaluating our students' pitches and guiding them through their entrepreneurial journeys. The judges will also have the tough task of selecting the winners, who will receive the following incredible prizes. For first place, entry to the Skydeck Pad 13 program, interview for Alchemist Accelerator, office hours with Pair VC and a fundraising strategy discussion, professional headshots, and a professional development session. For second and third place, professional headshots and a professional development session. And we'll also be giving out a People's Choice Award so you, the audience, can pick your favorite team. Before the teams conquer the stage with their pitches, let's give our judges the opportunity to pitch themselves first. I'd like to invite the judges to the stage.
All right. Good afternoon, everybody. Thank you very much for having me here. My name is Jay Onda, longtime supporter of the Collider Cup. I think this is my 14th one at this point. Thank you. I've been in the corporate world for about the last 15 years, working on venture strategy and innovation, helping bridge startups and innovation into the corporate world. And so what that really means is building partnerships and trying to mix the cultures between the old and slow versus the fast and new. Prior to that, I was on the startup side for about 15 years as well, as an operator, product strategy, and fundraising. I'm also a co-founding member of a nonprofit called the Sundial Foundation. And it's a nonprofit venture fund. We invest in purpose-driven founders, building venture scalable companies. And so I've been kind of all over the map on the venture side, early stage, late stage, and growth. And coming here has always been a pleasure, just because we get to get a sample of what's top of mind for the founders. Obviously, I think AI is embedded in everybody's pitch today. So I wish everybody good luck, and I look forward to hearing what you guys are working on. Thank you.
Hi there. Hi, I'm Sybil Chen. I'm the general manager at Berkeley Skydeck. Skydeck has been around for almost 12 years now, and we're located right in downtown Berkeley, next to the Berkeley BART station. Raise your hand if you've heard of Skydeck before. So I'm not going to go into it. So we are a proud supporter of SCET. Jue and her team do a phenomenal job. Like, we are such big fans of what the work that is being done. The pitches at the Collider Cup every year are just fantastic. So I think this is my 4th or 5th time judging. I've lost count, but we've been supporting SCET by offering one of the first place winner perks, which is admission to the Skydeck Pad 13 program. I hope all of you, at some point, the students in the room, when you are thinking about going to an accelerator or incubator, please keep Skydeck top of mind. Thank you so much. Stacy?
Hi, everyone. My name is Stacy King. I'm with California Innovation Fund. We're one of the shared carry funds here at Berkeley. We were founded in 2022 by a Berkeley Haas professor, and we invest in founders that come out of the entire UC system. I'm also a Haas MBA 2020 grad, so go Bears. We have actually a Citarja company in our portfolio, Echo Health, and so it's always nice to come back, to the beginning and continue to support entrepreneurs from their early stages. This is my second time judging, so really excited to be back here with you all. I have a particular focus on climate and climate hardware, so that's my passion within the startup and VC space, but really excited to hear the whole variety of things that you all have to present today. Thanks.
And please join me one more time. Thank our judges for coming today and lending their time and expertise as they help our students take their ideas to the next level. Thank you all. Our judges will select the first, second, and third place winners and the most innovative team. We also have a People's Choice Award where you get to vote for your favorite pitch using our live polling system. So please make sure to pay attention to each presentation and cast your votes after each pitch with the QR code that will be up on the screen behind me after the team pitches. At the end of all of the pitches, we will give you guys the opportunity and the time to vote again through our rank-based polling system to rank your top team. Before we begin, I'd like to review a few organizational matters. We do encourage you to take photos and videos, tagging SCET's social media account and sharing it using the hashtag #ColliderCup. However, we do ask that you keep your cell phone use to a minimum during the pitches out of respect for our presenters. Each team will present their 3-minute pitch, followed by 3 minutes of questions from the judges. And shout out to Sam for being our timekeeper tonight. Following the event, we will have an open networking session where you can chat with today's teams, judges, and others in the audience. Let's kick off the pitches and introduce our first course.
I'm going to introduce you to our first course, which is a new one to SCET this semester. In AI-powered startups, students rapidly prototype, validate, and launch real products using cutting-edge AI tools. Working in interdisciplinary teams, they explore large language models, AI agents, code generation systems, and marketing automation to build functional products with real customer traction. Guided by founders and industry leaders, students navigate real market challenges and end the course with a demo day, showcasing their product and impact. Our first team is Elect AI. If AI is the new search, they'll help you rank first. Please give it up for Elect AI.
Hi everyone, we are Elect AI and we help brands being found in AI answers. 5 months ago, we discovered that the customer journey has shifted. People are not using anymore Google and search engine, but they are using AI chatbots such as ChatGPT, Gemini, or Claude. And we are going from clicks to prompt. And it's for that brands need to adapt now, or they will lose the consumers and they will lose money. We are entering a new era, a new revolution of generative engine optimization. We are not speaking about SEO anymore, but GEO. And Elect AI, we are coming to the market with a GEO hub, where we make brands visible in the answer of AI, and we will show you how.
Our solution currently has 3 layers. We're starting with analytics, where we show where your brand stands across different AI models. Then we move to the recommendations layer, where we tell exactly what you need to do in order to enhance your visibility. So we provide insights at this stage. And then we move to the most important layer, something that differentiates us from already crowded and competitive geo-analytics market. At this stage, we help you to publish all the artifacts and content that was produced during the recommendation stage for you to become first eventually. Again, why our solution is very unique, because alternatives are not working. They're relying on legacy SEO tools that are not adapted to geo at all. They use analytics tool to know but not to act and not to become first eventually. And they hire expert people that just don't deliver. We estimated our market as 9.6 billion, and we decided to target first 2 verticals, hospitality and cosmetics, as these ones being the high-intent AI queries at the moment.
And in a fast-paced moving market, we moved quick. We developed and built an MVP in 2 months where we have an analytics tool that synthesizes thousands of parallel queries from multiple LLMs and sees where companies rank initially. We have a recommendations playbook that tells you where to publish and how to publish robots.txt and LLM.txt pages to be more visible. And we have a finally actual actionable tool that would publish Reddit websites to give you more visibility in AI search. We already developed 5+ pilots, and we have a growth to market strategy and pain validation plan. We grew very quickly. We had 30+ early discussions with founders. We have 5+ ongoing pilots and 215K potential ARR. And this is our case study Diffly that went from number 10 to number 1 using our tool. And we know the path to 80+ million ARR. We have a solid playbook, 800 enterprise customers, and 10% monthly growth. This is our strong team from multiple backgrounds, where we have Erwin that had YC experience for GTM. We have Dennis, who has technical experience at Samsung, and Alessia that has marketing experience at Yandex. And we're raising 1.7 million to get to Series A. We have a solid target where we're going to build our own platform and launch our own model for content generation. We're 18 months away, and we're looking to hit $2 million ARR. Be first, stay first. Elect AI.
Thank you.
Hi, I can jump in. Great pitch. I love what you're working on. It's clearly in high demand. I think a lot of companies are scratching their heads wondering how, what the equivalent of SEO is for the LLMs. Talk a little bit more about the case study and the key findings that you had from that case study, because it's not totally clear to me I'm sure there are countless competitors, and I'd also love to ask you briefly about your competition. But what is the secret sauce that you're bringing to the table? Because that part was not clear at all.
So what is nice with the case study is that we started, it was a B2B SaaS, so it was not our main target at first, but we discovered that we can do all the action possible to make them first, and so we decided to find all the things we can do for making them first, like Reddit, Wikipedia pages, and all the recommendation we can do. We did it manually first to make them first, or publish on Reddit, publish on Wikipedia, do some blog article, etc., like SEO, all techniques. But now, at the end, we achieved to make them first in 1 month and stay first because we launched our own Reddit publisher, our own also Wikipedia page updater, etc. And so thanks to that, we can keep them first on the long term, and it's where we bring the stickiness of our tool.
Is it a self-serve tool?
Yes and no, because for sure they can use the analytics tool, which is easy to onboard. For sure, we did 5 onboarding, and every time it took 2 hours to onboard, so it was kind of easy. But after, for the recommendations and for the actions, we started for sure manually because our product cannot be the best at first, and the goal is to be self-served. And I think today we have 75% of the job done and 25% remaining to go to the self-serve job.
Okay, so sorry, just a follow-on question here. So far it sounds like a discoverability tool for LLMs, right? Like you're positioning yourself so that LLMs could find you, you're massaging the content. And so if 2 competitors start using your tool at the same time, how does that help? Would I just get frustrated and saying, well, I'm not getting, number 2 rank, or I'm stuck at number 2?
Yeah.
Would you lose people, or how do you prevent people from going to the competitors?
Yeah, for sure. Yeah, it's super interesting because for sure, in the 2 markets we are targeting today, hospitality and cosmetics, we can have 2 competitors that are customers to Elect AI. And we thought about this, and it's for that we took those targets because the market depth is incredible. We have some Airbnb hosts doing some optimization, but we also have airlines and also hotels, etc. But this is not a problem also because all the intents are different, and all the queries, when you are asking ChatGPT to find the best hotel in New York, you have your own data. And so if I'm asking that, I will not have the same answer. And so we can have 2 competitors that are customers thanks to that.
I have some questions about your go-to-market. Could you talk a little bit about how you acquired your early customers for the pilots and how you plan to acquire more customers as you expand for your Series A?
Yeah. So we have three main channels: network, outbound, inbound. Our network, we can use our own network. So Alicia worked in SEO. We can enter Yandex thanks to her. And after, about the inbound and outbound, we already did some go-to-market job for a lot of startups. And so we know how to attack the market. And thanks to our outbound techniques, we got L'Oreal, for example. It was just outbound email. And after, we can also deliver them value, like sending them, yeah, look, for this prompt, you are not first, and we can help you being first. So kind of a geo audit and delivering the value before they are paying. And after, for the inbound, we will do a lot of marketing stuff like, look, this is the top 10 hotel in New York, for example, to take the example again. I really want to go to New York. And and after, yeah, thanks to that, we have like the whole strategy to be everywhere and every time. And so, yeah, to help all the companies being first.
Awesome. Everybody join me in thanking Elect AI for their amazing pitch. And please make sure to fill out this QR code behind me so you can vote in the People's Choice Award. And while you're doing that, I'm going to go ahead and introduce to you all the next course. In the Bio-Inspired Innovation Challenge Lab, students explore how nature's strategies can fuel sustainable entrepreneurship. Working in interdisciplinary teams, they design and prototype original bio-inspired solutions, drawing on biology, engineering, art, medicine, and business. Through hands-on workshops and case studies, from gecko-inspired adhesives to bio-informed robotics, students learn how natural systems can address real-world challenges. Our next startup of the afternoon is XVII, reinventing soft tissue biopsy needles with nature-inspired precision and half the force.
Good afternoon, everyone. We're Team XVII, and we created WIN, the wasp-inspired needle. This is my best friend, Allison, recounting how it felt to feel a needle moving around deep inside of her neck, not once, but 3 separate times. Soft tissue biopsies require 3 to 6 passes due to needle deformation, tissue deformation, and needle deviations. 1 in 5 of those patients will have to return for a repeat procedure because even after those multiple passes, they weren't able to get the correct sample the first time. This not only doubles the cost for hospitals, but increases patient discomfort and delays their diagnosis. Our team met in our bio-inspired design class to come up with a solution that traditional needles cannot. My name is Talia, and I led a research project on nano drug delivery at Golden Biotech.
Hi everyone, I'm Will, and I'm the founder of Microloop LLC, a bioremediation startup.
Hi, I'm Jolie. I was a software engineer at Microsoft and Citrix System. I integrated security data of the Intuitive Surgical and Johnson & Johnson MedTech to our new security platform.
Hello, my name is Anton. So I used to be like a team lead for an engineering project for NASA.
Our lead design, Hannah, is currently defending her thesis, but she brings 3+ years of industry experience from design consultancy to medical device startups. So we plan to enter the $2 to $4 billion soft tissue biopsy market, where there's a $2 billion opportunity and avoidable cost. We're starting with soft tissue biopsies because there's a high prevalence of repeat procedures, and it's a low-risk procedure to prove our concept. From there, we plan on moving to targeted drug delivery and image-guided therapy.
So to make our product, we had to find an inspiration, and we found one. It's through the parasitic wasp. So looking at its egg-laying organ, we can see it's able to penetrate to tough food with low force and in turn increase accuracy. And when it comes to traditional needles, conventional needles and biopsy needles, there are the 2 problems that they have to deal with, which is the buckling problem and the functional limitations, such as tissues getting stuck into the needle. And through our wasp-inspired design, we are able to overcome these challenges, such as the self-propulsion mechanism, which prevents buckling. It has a friction-based transfer system that stops clogging and has a symmetric design that enables steering. And when it comes to the WIN needle and who are competitors, we have 4 advantages. One is they have a low insertion force, high stability, low tissue damage, and high ease of use.
Thanks, Anton. So what is our market segment strategy? So first, we're going to be entering into like phantom testing pilot sites such as UCSF and their Interventional Radiology Center. And then from there, to gain more traction, we'd most likely partner with original equipment manufacturers such as Intuitive Surgical, where we could gain access to these high-up clinical leaders. From there, we plan on working this out for around 2 years to get Class 2 510K FDA approval. That's going to be our main process once we finish our engineering. And then from then on, we'll gain our first customers in interventional radiology departments and hospitals and start selling at roughly $5,000 a unit. So now looking at why us? Well, we're a high margin, reoccurring revenue model with tons of experience, and in a $13 billion market have the opportunity to save billions of dollars in avoidable repeat procedures. So thank you, and together, let's win every injection. Any questions?
If I can jump in, you mentioned that the first use case might be interventional radiology, in which case, like they might be working on blood clots and kind of unblocking blood clots. Can you talk a little bit more specifically about the actual use case? Because how would like the WIN needle work in, like interventional radiologists in many cases are like using needles to like actually chip away at the blood clot, if I'm not wrong.
Yeah.
With the flexibility of this needle, it might not have the precision that it's required. So maybe you can kind of detail the actual use case.
Yeah, we interviewed 15 interviewers, include the providers, patients, and clinicians at UCSF Health, and also the Intuitive Surgical manufacturer about the engineering part. And we found we interviewed Dr. Mark Fredman and Dr. Lee.
Anna Lee, yeah.
Yeah, Anna Lee, and they found their pain point is the accuracy improvement on the target on the first try and the repeated injections, and this will delay the diagnosis on the biopsies, and also we need to our product can avoid repeated and $2 billion systems cost, and also make the patient get early diagnosis on the biopsies.
And we're planning on starting with soft tissue biopsies specifically within the interventional radiology space.
Yeah. And just to add on to that, like when we talked to Dr. Lee, she basically said, yeah, we got to look at soft tissue biopsies because roughly their estimate was for each repeat, it was a $4,000 to $12,000 cost just for that repeat procedure, and that cost is incurred to the hospital and their insurances, and it's not the patient. So that was a huge pain point for them, so that's why we chose that target.
That's a very clever design. Just so I understand the math here, so you're saying you could replace a $12,000 procedure, get it down to $5,000.
So the $4,000 to $12,000 in repeat, is that what you're asking about?
Yeah, I'm trying to understand the mechanics. They said it has a recurring revenue model. So is each needle $5,000 and you use it once? And if so, like how does that compare to the current structure, like the pricing of how patients are dealing with it today?
Okay, yeah. So basically, right now we looked at our comparable competitors to get our first price, and this is a very low ball for what we're going to be selling at because we still have a lot of R&D to do. But our competitors are pricing from also $4,000 to $13,000. So this puts us in a good spot, and we think that with this value that we're going to bring onto it, we can raise our stakes up to $10,000. And even if our customers pay $10,000 per unit, they're going to be getting that return on investment in just over a year from that $4,000 to $12,000 in repeat procedures.
So when it comes to the technology side, there's like a robotic part which is like reusable, while the needle is like replaceable. So it's not like they're mostly investing their money into like the robotic part instead of the needles.
Are there any barriers to adoption? So with the equipment or processes that they already use for biopsies, or how does your product fit into that? Will it be training or anything like that?
Yeah, so our product with minimum trainings is they were doctor and patient and OEM, I mean the intuitive surgical robotics. They will never change their workflow. We are just the add-on and plug-in to improve the accuracy on the target, and also no clogging, no buckling. Yeah.
Great, thank you guys. Thank you so much, Sixth Sense, for that great presentation. The QR code is behind me, so please make sure to vote. Just as a note, the QR code is the same every time after every presentation, so feel free to just refresh your tab and vote that way as well. Great, so let me tell you a little bit about the next course. The next course is Connected Life, where students explore how mobile tech, AI, Internet of Things, and 5G can enhance daily life, work, health, and the planet. Students design and prototype always-on solutions while examining both the opportunities and ethical challenges of constant connectivity. The course focuses on building scalable tech ventures that leverage real-time data, automation, and intelligent networks to improve how we live and work. From Connected Life, we have Archetype. This team creates synthetic users to validate product features. Please give it up for Archetype.
More than 70% of the features teams ship are never successfully adopted. What a waste. And it's not because teams are not smart enough. It's because validating ideas with real users is slow, expensive, and fundamentally broken. Today, it takes 3 weeks to test even a small feature. 3 weeks before you can learn whether users really want what you're building. And companies spend more than $500,000 every year on average on validation. Recruiting the participants, running the interviews, coordinating research, that's a huge investment. And yet, most of that work still leads to the features that fail.
A paradigm shift is reshaping software. With the rise of LLM-based agents, software is no longer just a tool, it's additional headcount. Creating a transformative opportunity to reinvent how teams test the viability of features through synthetic users that accurately model real customer behaviors in simulation. We've built a product testing platform that lets teams upload prototypes, define personas, create hypotheses, and run viability tests with simulated customers, delivering insights about feature viability to help teams invest in the right features for their business.
And we call this agentic user testing. As you can see here, we build virtual users on top of these industry-standard persona framework. And don't get me wrong, they don't just chat, they actually use your product. They click around, form opinions, and build memories. If something works well today, then come back tomorrow. But if something frustrating, they might not be paying for it. So you might ask, why don't big companies like OpenAI or Google doing this? It's because their models are optimized for perfection. State-of-the-art, fast, and correct task completion. But for perfection for feature validation, that's useless. Real humans are unpredictable, and so should be your test. And that's why we built this humanity layer on top of our multi-agent system with memory and tools. It embeds human actions like confusion, emotional state, or inconsistency into your agent's reaction and action. And with them at scale, we deliver you customer insight before you invest.
We're currently building a pilot for a product team at Adobe, and we've kicked off early fundraising conversations with partners at XVII and Lightspeed Ventures.
For the first year, we're projecting 1 million ARR, driven by simple and transparent pricing model. We plan to charge $75 per team per month. And then at year 5, we're eager to achieve 40 million ARR. And we estimated our market as 15 billion. At this stage, to win our first customers, we're going after growth stage SaaS companies with product market fit. For them, we kind of prioritization tool to help test concepts before shipping, and with data-backed decisions rather than the guesswork. And we're approaching the market with design partnerships, like the Adobe example that Bryce mentioned. So we want to co-develop our solution together with product teams in exchange for the feedback, and then turn these early adopters into our first paying customers.
Compared to our competitors, Synthetic Archetype provides leading insights about feature viability, rather than simulated QA testing and lagging insights like A/B testing platforms. Today, we're asking for $500,000 in pre-seed investment in order to achieve our next steps, to hire founding engineers invest in AI model training, create a patent portfolio, and initialize our go-to-market motion. Thank you.
Sorry, I'm a little lost here about how you define what a feature is. And so, you know, if an established corporation has some kind of feature planning, they're looking at user behavior already, how do you put yourself inside that workflow and discovery process?
Sure, I can take that. So I think a good example that we've returned back to a couple of times is actually testing on Notion's AI feature. So that's a product add-on for non-paying Notion customers. It's a product add-on. One way that we can run, or that we can use our software, is to test whether or not customers, specifically Notion customers that fit their persona of who would use this AI add-on feature, whether or not they're going to discover that new AI feature, whether or not they find it valuable, whether or not they're willing to pay for it, click into it, add their credit card information, so on and so forth. And once they do that, what is their experience like? Are they using it as we, the product designers, managers, and researchers, expect them to use it? Are they misusing it? And is there an opportunity for us to maybe tweak our design before it goes out to the world?
If I can jump in, I love the idea, and we've been waiting to find a startup that can do this well. This is the third startup that we've seen pitching the same idea, and I'm wondering, one of the great challenges with creating kind of synthetic users is getting like an initial data set that will help you better extrapolate and figure out what the synthetic user might actually do, or better predictive capability. So can you speak to the technical aspects of how, the algorithm, how you plan on refining your algorithm so it's, the predictability is even stronger? I know you talked about the humanity layer, but if you can kind of pull back the curtain a little bit more, that would be great.
Yeah, sure. So as we mentioned before, part of our persona comes from these industry standard, like UX, UI researchers. For example, from their product experience, we got a lot of data on these. But more importantly, and actually thanks to the technological advance, recent years, companies are using things like post-hoc or things to capture session replays, and these are real user data. So we find a way to map these real user data and extrapolate them into the larger group of users to make sure that our actions are based on something real, which is their session replay, and from that, we further go into and to do our humanity layer. Hope that expanded well. Thank you.
Kind of a follow on to that. Yeah, I'm just curious how you are able to capture a broad enough subset of actual data so that you're getting perspectives from a wide range of people, and then you're simulating in a realistic way and like maintaining that data set of realistic human behavior.
Yeah, the key to that is we achieve some sort of generality. Because in our humanity layer, we just don't give them a fixed set of rules. We map these characters, these like intuition level of these human layer. For example, if I'm some designer, yes, there is like some fixed action that I can follow on, but more importantly, underlying these actions, there are some latent and hidden things inside of them. So instead of like capturing these action guidelines, we've actually captured things that are higher level, more meta level, to make sure that when we are doing statistical sampling to generate synthetic users, we are making them unique enough, but also showing enough human variation and matching them to the real human. It's not like a set of rules. It's something statistical, something sampling.
All right, thank you so much for your pitch, everybody. And in a second, you're gonna scan that QR code to vote in the People's Choice Award. And while you are doing that, I'm gonna go ahead and introduce our next course. Technology entrepreneurship gives students a deep dive into how high-tech ventures are created, funded, and grown. Blending case studies with hands-on work, the course walks students through the entrepreneurial process, from evaluating ideas and discovering customers to developing business models, securing funding, and preparing investor-ready materials. Next up, we have Halo, the world's first predictive solution for migraines. Please welcome me in welcoming Halo to the stage. Thank you.
Migraines affect over 1.2 billion people across the world. So we talked to 260 of them, who told us that migraines put their lives on pause. Right now, there are two solutions to chronic migraines. The first are preventative medication, which costs you about $14,000 every year. And the second are painkillers, things like Tylenol and Advil. But research shows that taking these painkillers before a migraine occurs is when they're actually effective. So that's the question. How do you know when you'll have a migraine? That's where EEG comes in. EEG uses tiny electrodes to read your brain signals and detect and predict migraines before they occur. But right now, there are no EEG-based wearables on the market, and it's because they look like this. They're clunky, intrusive, and unattractive, not something you're going to wear every day. So what if we could build a product that's predictive, sleek, and affordable, saving users over $14,000 every year?
That's why we built Halo. Halo uses discrete EEG behind the ear to read your brainwaves and predict migraines. Let me show you how it works. First, you get an alert telling you you're experiencing symptoms of an upcoming migraine. Then, you treat yourself and avoid the pain and disruption that comes along with a migraine.
So Nathan, why now?
Well, with Edge AI, we can do on-device signal processing that keeps your brain's data with you. Plus, Gen Z cares more about their health than ever before, and the population of severe migraine sufferers has doubled in the last 13 years. Our team of engineers is making this real. I bring hardware design experience, Skylar is leading our product development, Party is doing our AI training, and Diksha is leading prototyping with her background in EEG research. We're advised by a board of experts, including the co-founder of our only real competition. We asked people what they want from their migraine treatment, and they told us current solutions don't stack up. We'd be the first to give them what they actually want. With 14% of Americans having migraines and our hardware priced at $215 with a $6 a month subscription, that gives us a TAM of $1.7 billion annually. Our beachhead market are working women who can't afford the disruption of a migraine, and we'd reach them first through the UCSF Healthcare and Headache Center. We project to be cash positive in year 3 and reach 95 million ARR in year 7. That's why we're asking for $1.5 million to get our first generation hardware to market, to get partnered with our first migraine treatment centers, and to reach our first 800 customers. Live life pain-free with Halo.
If I can, question for you.
Yeah.
Because I on occasion suffer from severe migraines. So drugs like sumatriptan on the market, you take it within the first 30 minutes of your migraine, from the onset of your migraine, and it effectively just kind of stops it. So, and then you don't have to wear anything, right? It just pretty much ends your migraine as soon as it starts. Even the most severe kinds of migraine. So I wonder how, in your customer discovery, were you able to identify from some of these folks that you spoke to about their interest in wearing, something right under the ear versus taking something within a few minutes from the onset, which would pretty much stop the migraine? Thoughts?
Right. So we talked with a lot of people who varied in the severity of migraines that they have, and the people who found our device most attractive were those people who pay for very expensive preventative medication, so the medicine that promises to stop you from having migraines and costs over $12,000 a month. And so, like you said, there is medicine, including over-the-counter painkillers, that people can take after their migraine has started, but the huge selling point we aim to provide is to prevent people from having that window of pain, of having to look away from their screen, and basically just to better manage the pain, even for those who have existing treatment.
Thank you.
Do you all have you done any discovery on regulation or type of medical device you would need to be approved as, and subsequently how insurance could apply?
Yeah, so like I said, we're being advised by a co-founder of essentially the only company doing something similar, and in talks with him about what we need to do to make sure we fall on the health and wellness side, so we're not in like an FDA Class 2 medical device. And my understanding, though admittedly we're still figuring this all out, is that it comes down to how, like what we're telling people to do with the data we're providing. And so falling more on the side of they have their own treatment and we're just making them aware of a potential migraine happening versus telling them you should take medicine at this time. Yeah.
Talk to me a little bit about your hardware, right? I thought EEG, you needed at least a minimum of 2 connectors on each side of your head to cancel out the noise and things like that. Like I see it in the back of your ear. How does that differ from like the existing EEG tech that's out today? Like how do you do it in just with one data point?
So
data source,
that is a great question, and absolutely kind of the core of this is that, like you said, existing EEG is the whole skull cap basically to give you better spatial data, better grounding. And there's been a lot of research actually at Berkeley, at the Muller lab, on miniaturizing EEG and putting it behind or in the ear and figuring out how to do the signal processing that gives you reliable enough data to make a small form factor like that work.
Nice. Very cool. Thank you.
Thank you. Thank you, Halo. Thank you, Halo, for that amazing pitch. Please take a moment to fill out the People's Choice Award behind me or refresh your browser. Oftentimes, classes find themselves in a difficult position. There are so many good teams, and it's difficult to just pick one to compete in the Collider Cup. This next team comes from our at-large bid, an event hosted this past Wednesday to give teams from all classes another opportunity to compete at today's event. Through popular vote, the team ClaraLink won over the attendees of our at-large bid event. From the at-large bid, representing Regen Ven, we have ClaraLink, tearing down communication barriers between hospitals and deaf individuals. Please welcome ClaraLink.
Imagine this. Your leg feels numb. You're rushing to the emergency department. Lights everywhere. People running around. And you're scared, not only because of your leg, but because you're deaf and they won't understand you. At Covenant Health, this nightmare became reality. They failed to provide an on-site interpreter, and the virtual interpreter just didn't work. And while this led to an amputation that could have been based purely on a misunderstanding, the problem is even bigger. This story is only one part of a bigger problem in the United States. With 13 million deaf and hard of hearing people facing communication barriers every day, especially in the medical field, those miscommunication barriers can lead to drastic misdiagnosis and mistreatment. And it's not only risky for the patients, but also for the hospitals. An ADA lawsuit can cost a hospital hundreds of thousands of dollars, including ADA fines and legal settlements, not even including the reputation loss thereof. And with the current shortage of interpreters in the United States, there's just no way we can solve this the traditional way. And this is where ClaraLink steps in. We're building the first medical-grade translation tool for ASL. It works on-premise 24/7 and in 2 ways. The patient signs into the camera, which is then given out via speech and text to the doctor, and the doctor's words are displayed on the screen for the patient. And the opportunity for this technology is huge.
We are targeting a market of $6.4 billion, and we aim to capture $288 million in the first 5 years. There are currently 3 ways of medical interpretation. On-site interpreters are rarely available, and they're expensive. Video interpreters are less expensive, but they're also intermittently available. General translators cannot be used because they do not comply with patient privacy. We are looking to fill the gap that exists in medical translation. Through multiple interviews with key stakeholders, medical personnel, deaf and hard of hearing patients, and interpreters, we have validated that our product is the best fit for hospitals. We, ClaraLink, are repurposing the existing budget for ADA compliance. Compared to the hundreds of thousands, up to millions of dollars hospitals spend, we are giving a solution that is cost-effective and elegant. In the next few years, we will develop from ASL translation in California to language translation for all languages worldwide. Oops. Our team is really well equipped for this journey. We have a variety of skills ranging from technical to business, and we have a lot of group supporters and future advisors. So if you would invest us $200,000, we will be able to create a world where all patients can be understood regardless of their language. This is ClearLink, and thank you.
What do you all plan to do with the 200K? What are the milestones that you hope to achieve with that?
So with the 200K, we're gonna deploy 10 pilots within California in the next 6 months. What we're gonna do for this is basically focusing on hardware development, which will be a big part, the training of the model, which will be especially important concerning accuracy. And then we're gonna take this for those 10 pilots within regional and rural clinics in California to validate the product.
Why does there need to be a device? Like, it looks like the app is doing a lot of the intelligence, it's capturing the video, the motion, the action. What's special about the device, or why can't a doctor just install it on their phone?
So the reason why we're trying to deploy this on like an actual device is because we've interviewed with a lot of doctors, nurses, especially in emergency rooms and urgent care. And they've said that they need a device that's hooked to their computers that they roll around. It's really hard for them to actually bring in their own personal devices or use like an iPad that they have in their places. So that's why we chose to do a physical device, a standalone device.
In terms of just the development, I mean, what will be your greatest hurdle in actually building out this software? Is it the computer vision and the training of the model, or what do you anticipate as your greatest hurdle? And do you think that 200K will actually be enough to build and launch the product?
Yeah, that's absolutely a good question. Like, I think the next step, if we want to build a software, is first we need to like interview the hospital, like the most frequently asked question in emergency situation, and the corresponding ASL language that mostly frequent use. And then we need to like cooperate with the ASL community to gather the data set, because there is no existing data set focused on the medical field. So we need to also build a data set, cooperate with them, and then train the model, like the software. Yeah.
Thank you.
Thank you so much.
Thank you.
Thank you, ClearLink, for that great presentation. Please vote using the QR code behind me. And thank you to all of the pitches in our first half. We will take a break until 3:05 p.m., so that's a 7-minute break. So please come back to your seats in 7 minutes. Thank you. Sorry, I didn't realize what you were saying at first. Because I was looking at the timer and I was like, oh, I think there's still a minute left. Yeah. Good. I feel that because I'm happy with the great sound. That's what I was great. You guys are bye. For the online. Good catch.
normally the other kind of tape, but we do that.
Hi, everyone. Please take your seats.
All right, everybody, I'm going to ask you to take your seats, please, whenever you can. All right, everyone, let's take our seats, please, and thank you. Woo! All right.
Yes, thank you.
Hello, we're going to go ahead and get started. If you're in an end seat by the door, if you wouldn't mind moving in a little so anybody late can still have a seat. Thank you. All right.
Okay. Yeah, sure. Welcome back, everyone. How are we feeling? Woo! All right.
let me introduce you to our next course, which is new to SCET. The next course is Advanced Product Management. Product managers play an increasingly critical role in modern technology companies. They are charged with ensuring an organization that is laser-focused on creating valuable and highly usable products and services to address pain points and unmet needs for their target customers. In this course, students learned advanced product management skills, building on what they already know by putting theory into practice on a product or idea of their choosing. Next up, we have Verity, conquering misinformation with media literacy. Please welcome Verity to the stage.
Misinformation isn't just annoying, it's dangerous. It suppresses votes, spreads health myths that kill people, and preys on marginalized communities. And the platforms that created this problem, they just gutted their fact-checking. The truth is, these platforms will always exist, but what we can change is how we navigate them.
And that is why we're introducing Verity, a simple two-step solution for social media users to fact-check content on social media and improve their media literacy. So the way it works is when users come across posts on Instagram, X, or Facebook, they simply click share and then click Verity, which takes you to the app and gives you a rundown analysis of the facts and what's true and what's not true. So unlike traditional AI fact checkers, which would either just give you like a black or white true or false answer, Verity cross-checks the content with our trusted array of sources and news banks and provides users with context and relevant information, allowing them to make their own decision. So this problem has been solved before by a couple of other apps and services. However, these tools are either too expensive, too ineffective, or simply don't target the right user pain points.
Our goal is to democratize media literacy. We're starting a pilot program next semester here at UC Berkeley. We're talking with ASUC Senator Aiden Redding. He's getting us a pilot next semester, and our goal is to prove success so that we can get a 3-year contract with UC Berkeley to deploy it across all the students on campus. So researchers are asking for data about misinformation metrics, why people are susceptible to it, when they're susceptible to it, and what makes them susceptible to it or overlook it. So the university isn't our customer, it's actually our distribution channel. So our business model is actually aggregating and anonymizing data to then provide to misinformation researchers.
So our customers are research institutions and foundations that are tackling misinformation research in the United States and down the road across the world. There are over 65 research institutions in the United States tackling this problem, such as the Pew Research and the Knight Foundation. Our goal is to charge about $150,000 per research institution partnership per year, and our overall goal is to have at least 3 to 4 research partnerships by year 3.
So our ask is $500,000 to maintain our overhead and operational costs while we deploy that distribution strategy so that we can gain the users to have the data to then supply it and sell it.
Yeah, and this solves the overarching problem of the entire misinformation crisis. And
I'm Bobby, the CEO.
And I'm Shiza, the CTO, and together we invite you to join this mission. Thank you.
I'm just curious, there's an MIT professor who was the keynote at Web Summit a few weeks back, who has a company called Verity doing almost the exact same thing. Are you aware of that, and what are your thoughts about how you're differentiated?
Actually didn't come across it when I was looking into this problem. I did come across a research between, I think it was MIT and Columbia, that was targeting misinformation, and they surveyed a bunch of students and showed them like fake news versus real news to try to identify if people are able to discern. But I didn't come across the product itself.
Okay, and I might be getting exactly what they do wrong, but it's not too far afield. But all right, just checking.
Okay.
I think also the difference, we have researched our competitors. We haven't seen this keynote speech, but our competitors basically have a bank of sources that are inaccurate or accurate. And so ours is more nuanced and more dynamic than that. So that's what distinguishes us.
Can you unpack that a little bit more? Like, what does your data set look like, and how do you do the scoring, and how do I know that you're actually trusted versus other people?
Yeah, so it's innovative. Our business model is innovative because it basically uses AI we've inputted a backend of an array of sources so that Verity can actually read and decode a social media post, determine what it's attempting to claim, and then using our backend, check it with all of those sources, and then again, not provide necessarily an answer like our competitors do, but actually provide context and greater information, even though the post didn't include the context.
Right, and I think part of the process of building this product, which is going to be very essential, is creating that back end of resources, and that would also probably take a lot of talking with experts, partnering with organizations and news journalists, and really collecting this bank that we know can be trusted to provide information. And obviously that bank would keep growing, and we would get more sources that are reliable.
But you're trying to have a set source of resources. So I can't use like Elect AI to inject my stuff and try to hack or to persuade your algorithm elsewhere?
Yeah, no.
Okay, so only from trusted sources?
Yes.
Okay.
Yes.
I just kind of want to clarify the customer user. It sounds like people using the internet, social media platforms are the users, and they're trying to understand if their posts are true or not. Research institutions will pay for this data. Could you talk a little bit more about like your value proposition to a research institution?
Yeah. So on the user end, they're using this for a very different reason. They're using this in different contexts. Like when we spoke with the ASUC senator, he was saying, in our office, I could see all my staff using this. So he talked with his staff, and that's why they're on board. And then in terms of our data, it's actually valuable. Our competitors are charging around the same amount, but the difference is that their data is a little bit more black and white, and again, it's kind of just a bank. And so our data is valuable because it provides them the ability to accurately conduct their research in a way that is identifying why users might be susceptible to misinformation, kind of how their demographic actually might relate to that, their geographic demographic, different variables. And so this is kind of a much bigger picture as opposed to something like one of our competitors, Snopes. What they do for the same cost in terms of their data is actually just providing them sources that they can either believe or not.
Also, just to quickly add on to that, like one of the biggest key differentiators is, the entire process. We want to make it very easily accessible, where it's just like you're going straight from the post to the analysis. A lot of the competitors, you have to copy paste a link, or you have to copy paste the entire content and then switch tabs and then go to the app, which makes it a lengthy process, and users don't really want to do that. So we'd be enabling a lot more data collection at a much faster rate.
Thank you, Verity, for that amazing pitch. Please make sure you fill out the QR code behind me or refresh your browsers. And while you're doing that, I'm going to introduce our next course. The next class is not like one of your traditional courses. The Berkeley Method of Entrepreneurship Bootcamp is an intense 4.5-day venture workshop held at UC Berkeley. Typically offered the week before the fall and spring semesters, the bootcamp is comprised of UC Berkeley students, global participants, and working professionals wishing to learn entrepreneurship and innovation skills and gain experience with building new ventures with interdisciplinary teams from across the world. From the Berkeley Method of Entrepreneurship Bootcamp, we have OncoEquity. Give me a second. OncoEquity is dedicated to creating equity in cancer therapeutic outcomes. And now please clap for OncoEquity.
Your family is standing beside your hospital bed, and they are scared because you have exhausted all treatment options. Not a single treatment works because the current treatment guidelines out there don't benefit everyone equally. But then the doctor comes in with one last treatment, one last hope. What if we can take and analyze and use your unique genetic information to create a treatment that actually works on you? And that's why today we're here with Team OncoEquity, and we're dedicated to creating equity in cancer therapeutic outcomes. And the reason why everyone in this room might respond to a treatment differently is because of differences in our genetic makeup. And the lack of genetic testing can lead to adverse drug reactions, which cause over 2 million serious cases every year and are the 4th leading cause of death amongst all hospitalized patients. But there is hope, with at least 30% of these events being preventable via pharmacogenetic or PGX testing. In other words, what if we can analyze a patient's genetics and immediately provide insights on what treatments would actually work and wouldn't work on them?
After learning this, my co-founder and I realized that PGX is the path to creating more equitable and personalized solutions for our patients. Together, we have skills in both the clinical and the bioinformatics spaces, which drive our vision for implementing more equitable medicine to better patient outcomes.
So we guide physicians by providing them with genetic insights to provide more personalized treatment regimens. And we do this through our proprietary technology, which analyzes a patient's genetic information, identifies relevant gene variants, cross-references them with existing PGX data, and then provides a decision on how the dosage or treatment would be adjusted accordingly. And our technology is accessed through our EHR integrated platform, which exists within the physician's natural workflows. The physician has the ability to propose treatments that they feel would work best on their patient and immediately receive insights on potential gene-drug interactions, metabolism, scoring, and then the according dosage and treatment adjustment.
So our competitors, they tackle this issue of adverse drug reactions, but their platforms fall short. They generate these lengthy, time-consuming, static reports that cause physicians to not be able to interact dynamically with these PGX insights. Additionally, their platforms are external to EHR systems, meaning that it creates friction in physicians' daily workflows. So our solution addresses a market of $530 billion associated with adverse drug reactions that hospitals face every single year. And we built our business model on a per-year license, considering hospital size, the revenue that they generate, as well as their EHR license. And if we assume that we can save just 20% of these adverse drug reaction costs, then we would be saving hospitals almost 6 to 7 figures every single year.
So far, we validated the problem with over 50 experts in the space, and now we are going to partner with one private practice by next spring, which can allow us to create a report, publish our findings, and scale to a mid-sized hospital by the end of next year.
So this is why we're asking for introductions to clinics and hospitals in order to pilot our platform.
So join us today in creating a future where everyone can benefit from a therapeutic, regardless of their background. Thank you very much.
Oh, there it is. Okay. So we somewhat familiar with the space. We've the SCET Fund has invested in a couple companies in this area. Access to data is everything for this business. So what is your play in terms of quickly accessing data? Because some of the companies that we've seen do well have actually gone overseas to partner with hospitals, like say in Taiwan, where their medical system is fairly well integrated, and they're able to provide significantly higher volumes of data, patient data. Thoughts?
So I'm going to talk actually about a couple of sources of data. So the first source of data is where actually these insights are coming from. And so those are the actual PGX data. And so that data comes from existing guidelines such as the CPIC and PharmGKB guidelines. And these are, like I said, existing data that tells us gene-drug interactions. But the issue here is that that a lot of physicians are facing is actually implementing that into the clinics and workflow. So that's going to be one source of data. Then the second piece of data that we will be using is the actual patient's genetic information. And to do that we plan to partner with PacBio, and so we're currently in contact with the representative from PacBio, and there also is a Berkeley QB3 cluster, PacBio cluster here on campus that we plan to partner with to further work on the data access on the genetic side.
Yeah, and with our call with PacBio, the representative told us about a PGX-specific kit that analyzes over 49 SCET genes, which are critical in the way that a patient metabolizes a drug and are better predicting the outcomes that come from that.
How do you protect the patient genetic data? Like there could be a conflict between your insurance, having your genetic data, and then making decisions on coverage and cost. How do you kind of integrate into this privacy for patients, protecting their genetic data, making sure it's not affecting them adversely?
Yeah, the EHR integration is a great question, and a lot of our competitors struggle with that. Graham, did you want to talk about?
Yeah, so to make sure that we're being compatible with the current practices that physicians need to put into play whenever they're using this kind of platform, we are planning on using something called FHIR, which is Fast Health Interoperability Resources, which can allow us to access and use patient data in a very secure manner, at least when we are building this platform from the technology standpoint.
Talk to me a little bit about your backgrounds, right? And like why you're doing this and how far along you are on the actual development of your solution.
Yeah, so as it was shared, we started this in Gigi's bootcamp, which we were really lucky to do. And in terms of why I'm driven specifically to this mission, I was hospitalized when I was younger, and it was really the doctors and the nurses that took care of me that really rehabilitated my ability to walk on my own 2 feet again. And that's what drove me into medicine specifically. Priyam, did you want to share a little bit about your story as well?
Yeah, and so specifically in this cancer space, after having personal family history with this, this was a problem that I've always wanted to tackle on the research and science standpoint of this. And so then Rohan and I came together through our biochemistry class this past spring semester, and then began working on this as something we wanted to bring to life through the boot camp that occurred over the summer. And then to answer your second part of the question in terms of how far along we are with this. So far, as I mentioned earlier, we've validated this problem with experts in the space. We've built out our MVP, and we've been part of a couple of incubators on campus, such as the STEP program, the eHub program here on campus, to continue it with iteration of this. And so our next step from here would be to further talk with physicians on what exactly their workflow looks like, what exact information do they need in these kind of reports, and then that way we can do our first pilot study.
And then could I just add one last thing? So, okay.
All right, thank you so much, OncoEquity. Please give it up for them. And a quick reminder to fill out that QR code, please. Thank you so much. And without further ado, I'm going to introduce the next class. Today's world moves fast, and startups must move faster. Whether students just finished a Challenge Lab course, created a prototype, or took our Berkeley Method of Entrepreneurship bootcamp, Startup Catalyst is designed to help students build momentum, refine their strategy, and navigate the complexities of turning ideas into impactful ventures. Bless you. In this hands-on, project-based course, students joined a collaborative environment where their startup's unique challenges become the foundation for their learning. Guided by an experienced lead instructor and supported by peer feedback, industry speakers, and mentors, students explored real-world startup problems and worked toward actionable solutions. From Startup Catalyst, we have DealPrint, the world's first AI-native due diligence platform for small business acquisitions. Please welcome DealPrint.
Thank you. Hi, I'm Sebastian Crepé, CEO and co-founder of DealPrint, and we make buying small businesses easy. So to set the scene, there's 4.5 million small businesses in the US that are set to change hands in the next decade because they're owned by baby boomers, representing $10 trillion of value. This generational transfer of wealth is commonly referred to as the silver tsunami. But only 20 to 30% of the businesses that go to market actually end up selling because there's little to no standardization in the due diligence process of analyzing those companies, creating friction on every single deal. To put this in perspective, almost 80% of M&A activity in the US is through small businesses, but almost 70% of buyers are conducting a transaction for the first time ever. This is the last multi-trillion-dollar asset class in the US that has not been institutionalized. That's where we come in. DealPrint is the first due diligence platform purpose-built for small business buyers. Our platform co-pilots buyers through the process by allowing them to upload seller materials like historical financials and customer documents, where we surface red flags immediately and guide them through the entirety of the deal-making process. At the same time, we refer our users to lenders, CPAs, and lawyers that fill in the gaps to get the deal to the finish line. However, over time, we aim to automate those processes and give end-to-end due diligence support directly on our platform. Our collection of high-quality buyers ultimately allows us to attract the sellers and establish the new marketplace for small business M&A. To quantify the market, there's roughly 90,000 deals, small business deals, that get completed in the US each year. And through our subscription SaaS model, plus the referral fees we make, that unlocks a $2 billion market for us. However, as we automate the remainder of the due diligence services, that unlocks a $6 billion fee pool, all of which sits within a $25+ billion market opportunity for small business M&A. So far, we completed Pad 13 over the summer, which allowed us to sign 2 design partners and help us iterate on the beta version of our product, which launched last month. We're in the process of signing up customers for our limited release to allow us to iterate towards our public launch in the first half of next year in the hopes to raise a seed round by the time we graduate in May. Ultimately, those funds will be put towards automating those DD processes and establishing the common language for small business mergers and acquisitions. We're the right team to solve this problem because I spent the last 5 years in investment banking and private equity living due diligence nightmares every single day. I'm joined by co-founder Robert O'Brien, who spent the last 5 years building out Goldman Sachs' trading system, and we met the first day of undergrad at Columbia, so we've been good friends for almost 10 years now. We recently brought on Deep Shika, who spent the last almost 15 years building tech products across the Silicon Valley ecosystem. So as we look out at this silver tsunami market opportunity, the question is, are you going to grab a board and join us, or let this once-in-a-lifetime opportunity pass you by? Thank you.
So I happen to be very interested in this recently, so this resonates.
Awesome.
But I'm curious how you view yourself against competitors. A lot of people are aware of this silver tsunami. There are people like Silver Tsunami. There are people like SMB Deal Hunter that are developing programs. Like, how do you compare to her program? How do you think about your competitors?
Yeah, so in the competitive landscape, you know, there are existing platforms and people that are out trying to make competing products. However, almost all of them are targeting, you know, buyout size M&A processes and want the KKRs and Apollos to be their customers. The people that are competing in our space, the SMB Deal Hunter, the Cody Sanchez, they're creating very human service-based products and building out teams where they'll guide you personally through all of the steps. We're just doing that from a software perspective, of which we haven't found anybody trying to tackle that exact problem, and at the very least, no one's priced to that customer base.
Well, I've asked you all the hard questions before, so I'll try to throw you a softball one here. Go-to-market. I really do think that will become one of your bigger headaches.
Sure.
Even after you raise. So can you share more details about what will catapult you into the market so you're dominant?
So we've been interviewing a lot of people. We've roughly 150 customer interviews so far, and our original thesis was that the buy-side advisors that take the role of an investment bank, banks just don't exist at this size, would be our initial customer because they'd have longer contracts, have more deals at one time. But what we've come to realize is actually that's our distribution channel, because at this stage, those advisors really do more of the sourcing for the investors themselves rather than actually guiding them through the full due diligence process. So what we've found is by allowing them to use our customer on a free trial, or our product on a free trial basis, and starting to understand exactly what it is, then we're paying them referral fees, and they're getting out to all the customers that come to them looking for deals to buy and distributing our product through that channel. Yeah.
When I hear SMBs, I just think messy, right? Documentation, paperwork. How do you get that to be fully automated?
Yeah, I mean, I think there's going to be a component that there's always, it's going to be difficult to fully automate. However, what they do give is raw data oftentimes. So, you know, experienced buyers will ask for something like a customer cohort analysis, but the sellers don't usually know what that means, but they are willing to give like the bulk of all the data that they have. So if our software can kind of cut the noise through that and develop those types of analyses, that's the way that we can go through it. I think to your point though, our sweet spot at the beginning is gonna be like lower middle market search fund type deals, which is like $10 to $30 million, where it's like there is some structure, but they're still on the lower side. Banks are still not interested in that area. Yeah, thanks.
Thank you, DealPrint. Thank you so much, DealPrint, for that amazing pitch. Please make sure to fill out the QR code behind me or refresh your browsers. And while you're doing that, I'll introduce you to the next course, which is new to the Collider Cup, but not to SET. Applied Resilience introduces students to the mindsets and practices that help innovators and teams thrive amid uncertainty. Through neuroscience-informed frameworks, hands-on exercises, and reflective activities, students explore what strengthens or undermines their ability to bounce back. The course is structured to help students apply resilience tools to their ventures and career paths. By the end of the course, students leave with practical habits and a shared set of best practices to support resilient founders and teams. Before I introduce the team, I just want to say a quick reminder to please keep it quiet in the audience while our teams are presenting out of respect. Thank you. Next up, we have Bite Balance. Bite Balance automatically turns your pantry items into cheap, personalized meals. Give it up for Bite Balance.
The student food crisis is real. Half of California college students are facing food insecurity, and even at a world-class university like UC Berkeley, where we're striving to push innovation, half of us are struggling to afford basic meals. It can either be a Trader Joe's basket of fruits or the same price for one apple at Whole Foods. But how would you know where to go? Students are struggling to keep up with rising grocery store costs and stretching every single dollar as much as they can. According to our research, 75% of students spend over an hour researching and trying to figure out the best and most affordable meals. They simply don't have the time, and even when they want to dedicate the time, students need a faster and cheaper way to plan their meals. Vincent's gonna tell us how.
And that's why we built Bite Balance, where we turn grocery deals into meals. So what we do is we automate grocery planning based off items that you have in your pantry and items that are on sale this week at grocery stores. So how it works is you tell us what items that you have, and we extract deals using OCR to generate affordable meals for students. So to simplify shopping, we even allow users to automatically generate a grocery list based off these meals. So what sets us apart from our competitors is that recipe apps help students plan, while deal apps help students save. So we're basically first in where we integrate weekly deal integration, recipes, pantry inventory, and meals to grocery lists to basically one simple workflow where students could use to save time and money. So the grocery industry today is worth $800 billion, and students spend $60 billion on groceries a year. And retailers have information on what people actually purchase, but not information about what students plan to cook. So based off student interviews, 85% of students actually want recipes made from weekly deals.
And this is where we capture value. Bite Balance is free for students, but we monetize through affiliate revenues from grocery purchases and also by aggregating and selling anonymous user insight data to retailers. Some of our early adopters said that it saved them time, and it also gave them a better option, more better options for meal planning. So we plan to activate at UC Berkeley through student organizations, then use social media, of course, small groups of student ambassadors to gain some traction before to further unlock newsletters, basic needs centers, and also target different groups out of students. Our roadmap for the next 12 months is pretty clear. We will launch in January when the next semester starts here on campus with some students to gain retention, and then expand to 2 more campuses, widen our deals to different stalls, and then launch our launch our B2B insight board before then keep scaling. So we are students ourselves, so we really understand this pain point, and we are a team to turn this idea into a product. We are White Balance. Let's balance our budget and our bite. Our bite.
Can you talk to me a little bit more about this business model, right? And so you said that the retailers are actually going to pay you guys. What is their motivation to want to do that?
Yeah. The pain point is basically the retailers know who bought what, like which student bought bananas at Safeway. But they don't know is what they missed out. Like what did people buy at other supermarkets? What didn't they buy at Safeway? What did they buy at Trader Joe's? So what we basically do is we provide a lost sales analysis for them.
I really like this idea. However, I admit several, having pitched countless pitch competitions, there's always a startup doing something very similar. And the motivation is lofty and aspirational, and yet part of the challenge is always that it's not enough of a hair on fire problem for students to adopt this, right? To go out of their way and use this app. So how do you potentially overcome that key challenge and really deal with the longer term problem, which is user acquisition? Because it's just a nice to have and not a must have for your end customer.
Yeah, so we found that students spent a lot of time, over an hour each week, meal planning. And so we plan on launching in January to test our product and see if actually users are, we're basically testing retention and seeing if users are actually using our product.
But it's free. Like, why wouldn't you use a product that's free as a student? If you can save an hour, I have to do my meal plans. We all have to do. And we did interviews on campus and also online surveys with people. And why wouldn't you use a product that is free and that saves you time? And you can more focus on exams, on your homework, on assignments, and all that kind of stuff. So it saves time and money. And you get better food options.
I think if you elevate that visibility, people will start realizing the value of using that app, right? The stickiness isn't there. It's like, oh, it's nice to have, but I'm busy doing other things. I'll just wing it, right? And
exactly.
So when you actually show the ROI, right, like of why this app is valuable to the end user, then it's like, oh, I just saved you, $50 on groceries, this month because you used our app, combining coupons like that. That makes it more interesting, right?
Exactly, yeah.
All right, thank you guys so much for your pitch. And go ahead and scan that QR code so you guys can vote.
Thank you.
All right. This next course is new to SCET. ReGenVen confronts a core paradox of the global economy. While technologies like AI and quantum computing are creating unprecedented wealth and opportunity, work is becoming less secure and less equitable for billions. In this course, students design entrepreneurial ventures that generate fair income, workplace security, social protection, and genuine opportunities for development within a framework of environmental stewardship and social equity. Positioned at the crossroads of social upheaval and technological transformation, the course equips students to build startups and nurture a decent society that leaves no one behind. From ReGenVen, we have Mo Farm. You're not ready for this one-liner. This team turns farts into fuel by paying farmers to sell their uncaptured methane. Welcome.
Good afternoon, we are Mo Farm. My name is Tom.
My name is Ethan.
And we are turning emissions into earnings. So we spoke with Alex, he's a dairy farmer. His cows produce 210 tons of methane every single year. That's an emissions equivalent of driving a truck 2 million miles. Meanwhile, his margins are being crushed by automation, by regulation, and by rising costs, and that's where we come in. We're using metal organic frameworks, which are like molecular sponges, to suck up that methane, sell it as renewable natural gas, and pay farmers hundreds of thousands of dollars. We're turning the waste he couldn't even capture into cash, and a lot of it.
But how do we do it?
Well, Ethan, we use targeted suction, essentially huge vacuums inside barns to suck up the methane, capture it in those MOFs, which just won the Nobel Prize here at Berkeley. Go Bears! Compress it as renewable natural gas and sell it. The way this works is we come into your farm, we retrofit into your barn for free, no upfront cost. We then capture, compress, and sell the renewable natural gas, and then we share a third of the profits back to farmers. Alex just made $100,000 doing nothing.
In the US, our TAM is 30 billion, which within it we aim to capture 400 million from California alone. While industrial MOF technology exists in CO2 capture, MoFarm opens a new revenue frontier, harnessing the low concentration of MOFs in methane abatement. But unlike status quo methane abatement solutions, MoFarm is the first to monetize the gas that we capture. Our academic validation spans from Berkeley MOF and emissions research. Our solution offers that we know from our validation that we can provide a zero-cost and hands-free solution, which, according to Tristan at Malt, says that if we can even provide just an additional 10K in revenue, farmers will be lining up. Tristan is so enthusiastic about our product that he has personally offered to walk us into every single one of these American dairies that you see on the screen. Because of newly enforced regulation and a huge market opportunity, MoFarm aims to capture California dairy farms first. To achieve this, we are going to offer a pilot 50-50 profit split with our farmers to adopt first trials, utilizing our traction with Malt and Clover-Sonoma. And by the end of year 5, we're gonna offer a revenue, we're gonna project a 60 million revenue, looking to expand into international markets like British Columbia and the EU.
Absolutely. This is a uniquely interdisciplinary problem, and we are the team to solve it. From our carbon market expertise to our product development and engineering specialisms, a PhD in material science, and my logistics specialism, we will be able to execute end-to-end and capture the market. We're raising $1 million. We're going to spend just over half of that developing the mechanisms to build out this infrastructure. We're then going to allocate $350,000 to support our pilot programs, and over these 12 months, the 12-month runway that this $1 million will give us, we will be able to commercially capture and sell dairy enteric methanes in barns. Thank you very much. We've been MoFarm, and let's turn farts into fuel. That's it.
Could you talk a little bit more about your product development cycle and how you plan the stages of scaling?
Yeah, absolutely. I think the first big thing to say on that is all the Lego bricks of this already exist. So there's already existing industrial MOF solutions. There's ventilation in barns has been around for decades. And then there's an existing carbon market where people trade renewable natural gas. We're bringing them together, and that's why we think we can do that in a year. In terms of a timeline, we'll spend the first couple of months in the lab building the initial mechanism, and then we'll deploy it as pilots and work iteratively with the lab. But yeah, those Lego bricks are why we think we can have it done by the end of the year.
Can you talk a little bit more about the hardware development costs? I mean, by the way, hats off, great presentation, and way to take a unsexy business and making it funny and entertaining. This part right here, the MESA, the compression of methane gas, that whole process, it could be quite expensive to develop. So talk a little bit more about how far along, if you even have the talent on the team now to build out this actual compression, and what are the hardware costs to retrofit each dairy farm?
Sure.
Say like a dairy farm of like 100 cows. Like what's the cost to get it done?
Yeah. So we're definitely focusing on larger farms than 100. So looking at least 1,000 and up. There's 255 farms in California with 2,500 cows, and that's the sort of level we're talking about. In terms of unit cost, currently on the financial slides there, it says $140,000. Most of that is the cost of the MOF itself that we're buying. There's a paper that just came out from the USDA that projects that cost will drop down to about 60 grand in total as we can buy more MOF. So I think that's the big development cost, and the big installation cost is the cost of the actual material, and that has like a tremendous fall down from like $100 to like $12. Yeah.
And so your business is to run this end to end. Are you going to provide like the support, everything else? You're going to do the pickup, the selling? And who ultimately buys the methane?
I mean, there's a couple of different buyers on the RNG market. I think the underlying thing is anyone who has to do Scope 3 reporting and uses methane wants to buy RNG if it's not too much more of a premium, because then they can sort of deal with their Scope 3 emissions, or just any sort of industry or company that wants to be more green. Yeah. Good work, guys. Cool. Thank you very much.
Awesome. Thank you, guys. All right, and fill out that QR code so you can vote. All right, and with that, we have concluded the pitch portion of today's event. I am going to now send the judges off for deliberations, and while they deliberate, let's talk about the following incredible prizes that some of the teams that just presented will be receiving. The first place winner will receive entry into Skydeck's Pad 13 program, an interview for Alchemist Accelerator, office hours with Pair VC and a funding strategy discussion, headshots, and a professional development session. Second and third place winners will receive professional headshots and a professional development session.
Now it's time for the final round of voting for the People's Choice Award. This QR code on the screen behind me is separate from the polls we've used throughout the event, so please go ahead and scan that. And you can access the voting form, in which you'll rank your top team. All the pitches today were truly outstanding. Across this diverse group of students, everyone came together in an SCET class to collaborate and turn their visions into a reality. Let's give a big round of applause to all the students, coordinators, and professors in Cohort 17 of SCET. You all contributed to creating an incredible environment that made all of these amazing pitches possible.
And to get a quick show of hands, who attended the Alumni Expo at the beginning of this event? Hey, okay, what's up, guys? So great news, you all must be excited to see who the winning team is. And before we announce our Collider Cup student winners, we'd like to announce our Collider Cup Expo champion and invite them to the stage. If you missed it for the 4th time in Collider Cup history, right before our event, we hosted an expo where students We hosted an expo where students that have taken the SCET courses presented their startups, and the attendees voted on their favorite alumni team. All these teams contain students who have taken an SCET class and have used the skills that they developed to continue on their entrepreneurial journeys. It doesn't have to be a project developed in a SCET class. The teams this year are Hope AI Disclosure, Health Pilots, Blue Chip Biosystems, and AI Scouts. Any student who has taken a SCET class is eligible to participate in the expo next semester.
The expo teams also had the opportunity to partner with the House Fund. This helps pair Berkeley founders with the resources they need to thrive and develop their startup. From mentorship to funding, this is about unlocking the potential of unstoppable student entrepreneurs. The winning expo team has the opportunity, bless you, to have an interview with Pair VC for the chance to receive $25,000 in an uncapped safe investment, have an interview with Alchemist Accelerator, attend the professional development session, and get professional headshots. If you've taken an SCET course and are working on a project, scan this QR code behind me to apply for Spring 2026's Expo. Any SCET student or alumni can participate. Many of these founders are previous Collider Cup participants. Some of our past Expo teams have been invited by SCET to pitch at TechCrunch, including Uncracked, Optogenics, and some have been nominated by SCET to represent UC Berkeley at the ACC in Venture competition, such as Code Blue AI. Big round of applause. Without further ado, this year's Alumni Expo winner is Blue Chip's Microsystem. Blue Chip's Blue Chips Microsystem is a team that participated last year and is proof not to give up. Let's invite Blue Chip Microsystem to the stage to share their pitch.
Awesome. Thank you all for joining us today. And today I'll be telling you all a little bit about what we're doing at Blue Chip Biosystems. So we're building human-like models for preclinical drug development. So one of the biggest problems that the healthcare industry faces today is that so many drugs that go through clinical trials fail, over 92% of drugs. And unfortunately, this means that many of these drugs had adverse effects for patients. And on top of this, it also costs up to $100 million for one failed phase 3 clinical trial. So one of our big goals is to build a more accurate human-like model to test these drugs better before they go into clinical trials to replace animal models. This will not only save animal lives, but on top of that, it will also save millions of dollars and also human lives. So what we are building is a organ-on-a-chip system. These organ-on-a-chip systems are built with human cells, just like mine and yours. But on top of this, our unique organ-on-a-chip system has the unique ability to be highly customized for diverse backgrounds of people. This is particularly useful because previously, organ-on-a-chip systems didn't have the capability to be made into male or female phenotypically, as well as to have aged capabilities. So with our organ-on-a-chip system, we can actually accelerate the age of the chips by 60 years in human time in just 4 days. So this means that we can take cells from a 20-year-old person and make them look like an 80-year-old person in just 4 days. And this is particularly useful because many drugs have adverse effects on people as they get older. A typical example that I give is that when you're young, you can go out and drink, and the next day you're fine, right? But as you get older, if you drink, then your liver struggles a lot to process all of that alcohol, right? So this is just one example of a tissue that struggles a lot as you get older. And we've seen examples of this impacting drugs, especially with liver and Alzheimer's patients. For example, several categories of Alzheimer's drugs have actually failed because companies failed to take into account that your liver significantly weakens as you get older, and it's actually caused liver toxicity in patients during clinical trials, causing these drugs to actually poison their patients and fail clinical trials. And a little bit of background on how this technology was developed was actually, I just completed my PhD here at UC Berkeley, and over the course of my time, I worked with Professors Andreas Stahl and Irina Conboy, and through this collaboration, we actually developed this product. And I had my co-founder here, Declan, actually playing badminton at UC Berkeley right here in our RSF.
I have this, just the clicker.
Oh, yeah.
So yeah, it's really important that we have this way to generate academic technologies, but it's also important to determine whether they have commercial viability and whether we can spin them out from the lab. And so if you look at the just drug development market in the United States alone, over $130 billion is spent each year. And so if we're looking just at preclinical, which is what our focus is right now, and our fat liver chip, which is the current system we have, and even 10% capture, we're still looking at about $300 million market. So Cameron mentioned some of the advantages of the chip in terms of aging and being able to recreate male and female environments, not only chromosomally, but also genetic expression-wise. But there's current organ-on-chip companies, Emulate, Memetis, and Obatala Sciences. They can't do this, right? It's really important to take into account, if we're trying to create a more human-like system away from animals, we need to take into account a lot of humanity. And so using these different factors in our organ-on-chip device, we can tackle a few different applications, including anything related to liver diseases, including MASH and adipotoxicity, as well as a platform for rejuvenation and longevity drugs. Currently, like Cameron said, you have to age mice for 2 years, and if you're an industry partner, which we've talked to a few of them, each mouse that is older costs about $600 a mouse. And so it's incredibly expensive to do large-scale studies on mice in longevity and rejuvenation therapeutic studies. And so there's a lot of people in biotech, even just taking 300 of them. Our plan is to take drugs from pharmaceutical companies and run assays for them and give them back results. And so this includes larger screen-out studies, as well as in-depth drug development and drug analytic studies. And we think even with 300 customers, we can make about $100 million a year. And so what we're asking for right now, for 1 year of runway, is about $1.5 million. This will cover R&D costs, the team, including some expansion on the team, as well as other really important costs, such as facilities and IP licensing and legal. And so it's really important. What you can take away from this is that the FDA, and I think in general scientists as a whole, realize that animals are not a great system and not human-like enough for a clinical trial and healthcare ecosystem. And so it's important to develop new technologies and to really put money and focus on what these technologies can do in the future and the potential that they have right now. And so Cameron and I are building with 2 of the professors here from Berkeley. We really think can have a large impact in the future and create a more human-like system for all of clinical trials. So thank you.
All right, thank you guys. You can come over here. Thank you. You can put your mics over here. Thank you, Blue Chips, for your pitch. This team came from a Berkeley SCET course and is still connected with the SCET organization. You too can stay connected through the SCET Alumni Connect. And in a few moments, we're going to have you re-vote for the People's Choice Award. We had a technical issue, so when you see that QR code, please scan it and vote one more time for us. Thank you. But I will continue until then. So, this is the time for alumni to connect, continue to share their journeys, and to inspire you all. At SCET, we believe in SCET for life. So whether you have taken 1 class or 7, you are a part of our community, and we love hearing updates, promoting what you are doing, and supporting you in any way that we can. Earlier this year, for our 20 and 2025 campaign, we started the first SCET Alumni Association. There's that QR code. If you are graduating this semester, consider yourself part of the SCET community and want to continue living up to the motto SCET for life, please scan, in a second, there's going to be another QR code, to be part of our alumni group. We'd love to pass it off to Ju A. Chu for a few words and to give out some awards.
Thank you. And I'm going to put the expo. The People's Choice ranking one more time. There was a team that was missing, so apologies for that. So please go ahead and enter that. I'll give you a minute to do so. Awesome. Thank you all. Perfect. So actually, I'm going to give it back to Daniela. She's going to talk a little bit about one of the many ways you can earn the SCET certificate. And she is one of our recipients from doing the study abroad program.
All right. So myself, amongst actually a couple of people from the audience, attended the Global Entrepreneurship and Innovation Summer Abroad program in 2024. And it was one of the best and most informative experiences of my life. Going into it, I had no idea what to expect, but I had a friend who went the year before and said, this was the best month of my life, no questions asked, do this program. I'm a poli-sci major, so I had not touched entrepreneurship before, and it ended up being one of the most valuable and holistically educational experiences that I've ever had the pleasure of experiencing. We were able to develop like VC-backable startups with people from all over the world, and to be able to communicate with people from such different corners of life is an incredibly educational experience. You have to learn about communication and how to lead. So being able to experience this program and constantly being put out of my comfort zone, coupled with the actual curriculum of this program, which is incredibly unique, was such a privilege. It's very experience-based, and it's not lecture-based or anything like that. So if you are a student and you have the opportunity to attend this program, you can come talk to me or any of the other alumni afterward, but I would 100,000% recommend it. And yeah, that's my experience, so thank you.
Perfect. So how many of you have taken SCET classes before? Awesome. Anybody enrolled next semester? Excellent. So these are our spring classes. If you are not enrolled, you will likely be on a wait list at this point because most of our classes are actually full. But you can check them out. Obviously, as many of you know, there is movement on wait lists, and all of our classes will count towards the SCET certificate. How many SCET certificate recipients are there? Woo, awesome. So one way to get it is the abroad program. The other way to get the certificate is through doing classes. So it's our Newton lecture series, which takes place here on Tuesday evenings. And then 5 units of SCET classes. So 5 units, not 5 classes. And then the other way is Newton, 4 units of SCET classes, and a startup internship. So the startup internship, if you have done an internship in the past, it has to have been during your Berkeley career. It doesn't necessarily have to have been when you've been doing your SCET classes. If you're curious if an experience or internship that you've had will count, you could always email me and ask about that. And the biggest thing is we really want it to be a true startup because, as many of you know from taking our classes, the experience in a startup is every day is a different thing and you're wearing lots of different hats. So it's really important that you look at our website to see excuse me, what the specific requirements that we're looking for that. And then before I hand it off to Jesse for our awards, I just want to thank all of the students. We have front desk interns at SCET, course coordinators, ambassadors, ops interns who have all helped put all of this together today. So let's give them a big round of applause for everything. And then also just want to give a big round of applause for Anika and Daniela, our MCs today. This is their second time doing it, so really great job. And now I will hand it off to Jesse Deeker, our Chief Operations Officer.
Thank you. And can we give a big hand for Jue for... Fantastic. My name is Jessie Deeker. I'm the Chief Operating Officer for the Siddhartha Center. And it is my pleasure to be able to do our awards and announce our awards today for Most Outstanding Course Coordinator and Most Outstanding Instructor. Each semester, we seek nominations from students, faculty, and course coordinators and staff to recognize an outstanding instructor and an outstanding course coordinator. This semester, we received a record number of nominations. Those were fun to look through. And we are deeply grateful to everyone who participated in the process. So first, we are going to do the Outstanding Instructor Award, which honors an educator who embodies excellence across multiple dimensions of teaching and engagement. This individual demonstrates outstanding expertise in their field, developing innovative curricula and employing effective pedagogical practices that enhance learning. They have a remarkable ability to ignite student interest and curiosity, making subject matters both accessible and inspiring and beyond the classroom. And this really shines in a lot of the nominations. They contribute meaningfully to the department, the institution, the broader community, and most importantly, students and their experience. Their dedication to fostering diversity and inclusion enriches the educational experience for all, while their mentorship leaves a lasting impact on the students and colleagues they support. So, drum roll. Oh, never mind. Rana, Rana, Rana.
A few words.
Oh, hold on, I get to say a few words first. as you can see why we maybe received a record number of nominations this year. We are so lucky to have Rana. She's actually a new instructor. This fall semester was her first semester with SCET, and we are so happy to have her. SCET, sorry, I'm switching, I promise, I'll get there. She's an extraordinary instructor. What's so cool about our new space is we have our program delivery space where most of our classes are at. We also have our office space in a similar area. And so often I'd be on a Zoom call in my office and just hear so much fun activities going on that I had to pop out multiple times. And that's all thanks to Rana and all of her preparation and delivery of the materials. So I have more to say here, but I think we're so happy to have you, and congratulations, and thank you so much for supporting our students and being a part of SCET. So if you want to say a few words.
Wow. We good? Am I on? All right. To say this is unexpected is an understatement. I've disturbed Jesse's piece a lot, so actually this class has, so thank you guys. I think it's just a gift to get to be an instructor and to actually get to be with this class. It's really such an honor to be part of everyone's journey here in this class. I think that entrepreneurship is a crooked journey for sure, and there's a lot of shins to be bumped. But when I came into this class, I had one simple premise, that who you work with and how you do it matters more than what you do. And I think that's proof today, at least seeing everyone's presentations, but I'm especially proud of ClearLink and MoFarm. Because those are silly taglines, but big problems. And when we can do this just a little bit, when we can actually, every person I've met, I've learned from, and they've changed me just a little bit, and when we can all change each other a little bit, we can solve really huge problems. So thank you, thank you. I don't even know who else to thank, but it's just an honor to be up here. So thank you so much.
All right, and next we have our Outstanding Course Coordinator Award. So each semester, SCET classes are supported by a team of dedicated students who serve as course coordinators. And the Outstanding Course Coordinator Award honors an individual who demonstrates professionalism, responsiveness, dedication, commitment to the course and to students, and having a meaningful impact on individual students. And so this semester, now can we do drum roll? Drum roll? Is congratulations, Maggie. So Maggie is an exceptional course coordinator. I mean, it is obvious we had a fantastic class because we had both the instructor and the course coordinator, and that's, very much in thanks to you. Maggie also served in a leadership role this semester with the course coordinators, and we really appreciate all the work that you contribute, not just to the class, but the entire SCET ecosystem. So thank you so much for all that you do.
I just want to say thank you for SCET for creating a community where I've been able to grow as both a learner as well as a leader the last 4 years of college. Other than that, I also, from course coordinating for applied resilience with Vicky, and now this inaugural class with Rana, I wouldn't have been able to do it without the amazing SCET community. Thank you, Jue, for literally being the backbone of SCET and everything you've done. I also want to thank Rana so much. She has taught me that successful teams come from diversity as well as regeneration, and just has fundamentally changed how I view leadership. So thank you so much for that. Also, thank you for the amazing RegenVen class. You guys are incredible and extraordinary. And then also thank you to my friends and family who has listened to me talk about RegenVent 24/7. But yeah, thank you guys so much. Go Clarelyn, go Mo Farm.
Okay, and I'm going to hand it back to the MCs. That concludes the awards section for today.
Great, thank you so much. Awesome. So the judges are back from deliberations, so I'm going to go ahead and announce the winner of the People's Choice Award, and then I'll hand it off to Sybil to announce the most innovative as well as the top 3 teams. So for the People's Choice Award, can I get a drum roll, please? The winner is Mo Farm. Congratulations! Awesome, and now I'll give it up for Sybil to go ahead and announce the rest.
All right, now the moment we've all been waiting for. I have to say, Jue and the entire SCET team do a fantastic job every single Collider Cup, and it just gets better and better. We were talking about it in the judges' room that just the caliber of pitches. I mean, I see many familiar faces. I know some of you come back pitch after pitch. It's really extraordinary. So for all the teams that were up here, you should feel proud of yourselves and give yourselves a pat on the back. There were so many great pitches, and I wish we could accept many more PAD 13 teams to the PAD 13. But in terms of most innovative, the judges selected, drum roll please, 6 cents. For the wind needle, that's very interesting. We love the bio-inspired innovations. All right. Okay. Oh, we're gonna I guess come on up if I call your startup. Oh yes. And then are we inviting the startups to come up too, or no?
Yeah, startups come up, take a picture, and then sit down.
Okay. All right. Drum roll, and I'll announce the 3rd place winner. The 3rd place winner was Onco Equity. Congrats. Congrats. All right, thank you to Onco Equity. All right, drum roll for the 2nd place winner. 2nd place, Mo Farm. Congrats. All right. Can you guys hear me okay? And last but certainly not least, drum roll please, the 1st place winner for today's pitch competition is Sebastian and Deal Print. I just want to say, Sebastian is a known quantity to SCET. He actually has deferred acceptance. He had deferred his acceptance into the fall Pad 13. And so we are actually going to extend MoFarm an acceptance into Pad 13 as well. So. All right. Thank you, everyone.
Thank you so much for everybody for coming. Thank you to our judges. If you are a participant in the Collider Cup, please come up to the stage for a final group photo. And then everyone, please enjoy networking and food outside. So thank you, judges, again, and thank you, everybody else. How was it?
It was great. Yeah, I might also extend Onco Equity. I'm going to chat with them very briefly just to validate. But probably will accept them as well.
Awesome. Cool. Thank you so much. I'll email you and Ethan.
Yeah, that would be great. Yeah.
Awesome. Team photo, yay! Congrats! Yes, I'll email you all the details with all the prizes and stuff. Okay, cool. So, yeah, congrats, Sebastian.
Nice work.
Go, baby. Congrats, man. Congratulations. That was amazing.
We hope to see you there.
Yeah.
Yeah, you definitely have to. I'm sorry. No, you're in front of me.
Is there a height requirement for your team? Is that the way it works? Hey, is this It is. I'll take it. Amazing. Wait, does anyone want to come down? Yeah, we just. Oh, we got a win. Yeah. Okay. I'll go after you. Yeah. Everybody. Yeah, come on. Yeah. Not everyone is in. But thank you. Oh, thank you.
That's all good. Honestly, I think it's 3, 1, 2, 3. Okay, we're good.
Oh, thank you. LinkedIn post.
Sorry. Hey, honestly, I'll take it.
Nice job, guys. Hey, we'll take it. Most innovative. I like it. Yes, sir.
Thank you.
That was awesome. You guys did a really fantastic job in handling the questions. Thank you.
Really good. We had very good Gail and Bob practice very well.